All right, welcome to Unit 6, Section 3, Newborn Medical Care and Tests. After studying this unit, you'll be able to describe the first medical care babies receive at birth, differentiate between an APGAR test and the Brazelton scale, give examples of newborn screening tests that are performed within 24 to 48 hours after birth, and evaluate the types of care and treatment needed at birth for premature and other high-risk babies compared to healthy babies. From birth to 1 month of age, a baby is medically known as a neonate. Okay, neonate is from the Latin words neo, meaning new, and natus, meaning born. Generally, in hospital births, a pediatrician often comes to the delivery or birthing room just as the baby is born. A pediatrician is a doctor who cares for infants, children, and teens until adulthood when growth is complete. If the mother is using an obstetrician, this doctor continues to complete the delivery process. Family doctors might do both jobs, but as you can imagine, this becomes almost impossible. Either the mother and or baby need extra assistance. After delivery, the baby is often held head downward and the doctor suctions fluid from the nostrils and mouth. The mother may hold the baby on her abdomen until the cord is clipped. The nurse then takes the baby to a special table with a heater and dries the newborn with warm towels. Pediatricians oversee the medical testing and care of the new baby. Okay? Pediatricians measure the newborn's chance of survival using the APGAR test. The APGAR test checks the baby's pulse, breathing, muscle tone, responsiveness, and skin color. The baby's heart rate and breathing are the most important. Skin color, which is a sign of blood circulation, is least important. This test is given 1 minute and 5 minutes after delivery. The baby scores either a 0, 1, or 2 in each of the 5 areas. Okay, the 5 areas are heart rate. They get a 0 if they have no heartbeat. They get a 1 if it's slow, if it's fewer than 100 beats per minute, and they get a 2 if it's more than 100 beats per minute. Their respiratory effort, if it's absent, they get a 0. If they have a weak cry or they're hyperventilating, they get a 1. If they have a good, strong cry, they get a 2. For their muscle tone, if they're very limp, they get a 0. If they have some flexing and bending of their extremities, they get a 1. And if they are well flexed with their extremities, they get a 2. Okay, their reflex irritability, if they don't have a response, they get a 0. If they do some motion, they get a 1. And if they cry, they get a 2. And then lastly, their color. If they're blue or pale, they get a 0. If their body is pink, but their extremities, so their arms and legs, are blue, they get a 1. And if they're completely pink, they get a 2. Okay. Healthy babies, obviously the score at 5 minutes after birth should be higher. Healthy babies should often score a 6 or 7 at 1 minute and 8 to 10 at 5 minutes. The best score possible is obviously a 10. For the first score, the umbilical cord is usually still working, but usually has been clipped by the second check. If a baby scores 7 or less at 5 minutes, he or she is tested again at 10 minutes. A low score means the baby needs special medical care. If the vital signs are not good, the pediatrician will attempt to to resuscitate and stabilize the newborn. If there are still problems or if the baby is a preterm birth, the pediatrician orders care by other means, which we'll talk about later in this lesson. For healthy newborns, the nurses begin health care after the APGAR test. Antibiotic drops are put into the newborn's eyes. Because the newborn's temperature is not very stable, a thermometer is attached to the chest and the baby wears a snug cap. Newborns will typically receive a vitamin K injection to help their blood clot. An injection of penicillin may be necessary for newborns fighting a possible strep infection. Nurses take a sample of cord blood to determine the newborn's blood type and antibody status. Before the newborn is taken from the delivery room, footprints are made and name bands are placed around the newborn's wrists and ankles for identification purposes. The pediatrician looks over the records and checks the newborn again. All right, so some newborn screening tests. Before the mother and newborn leave the hospital, they will order tests to determine the newborn's health status. Screening tests are performed within 24 to 48 hours of birth and are repeated in 2 weeks. Any tests with out-of-range results require further testing. These tests can make the difference between wellness and permanent disorders or death. Blood tests. Doctors conduct blood tests on newborns by collecting a few drops of blood from a heel prick. So they prick the bottom of their foot. Screening can check for anemia, jaundice, and developmental disorders. Anemia is a condition that occurs when the level of healthy red blood cells, which carry oxygen to all parts of the body, becomes too low. Mild anemia often does not require any treatment, but a blood transfusion may be necessary to treat severe anemia. Jaundice is a liver condition that can make the skin, tissues, and body fluids look yellow. A buildup of bilirubin in the blood which is a yellow pigment, causes jaundice. Newborns, especially premature babies, have problems handling bilirubin due to their immature livers. Doctors treat jaundice by using light treatment or phototherapy to reduce the skin's yellow color. Hospitals may also treat newborn jaundice with fiber optic phototherapy, in which a flexible light pad is wrapped around the baby. More research needs to be done on this newer method, but current studies show it to be less effective than conventional methods in full-term babies, but equally effective in treating preterm babies. Doctors also screen newborns for developmental disorders. The number of disorders the doctor will check varies depending on each state's screening program. Most states require tests to check for the following things: PKU, phenylketonuria, the condition in which you're unable to metabolize an amino acid. PKU is treated by diet. Untreated PKU can lead to seizures and impaired intellectual abilities. All states will check for this condition. Hypothyroidism, where the thyroid hormone deficiency can lead to slow growth and abnormal brain development if left untreated. Galactosemia, is which the baby is unable to digest the sugar in milk. Blindness, impaired intellectual abilities, and death may result if it's left untreated. And sickle cell anemia, in which the body makes sickle-shaped red blood cells. The cells become blocked in blood vessels, causing pain and body damage and increasing the risk of infection and possibly death. Blood specialists provide regular medical care for this disorder. Then a hearing test. Doctors often conduct hearing tests on newborns. To get accurate results, they have to drain any fluid in the middle ear. The fluid is usually squeezed out during a vaginal delivery, but babies born via C-section should wait about 48 hours after the delivery before being given a hearing test. The loss of hearing can delay language and concept development. A heart test. Life-threatening heart defects may affect the way babies' hearts function or the way their hearts are shaped. Heart defects may not be apparent at birth, but become evident or critical soon after birth. A group of severe heart defects is medically referred to as critical congenital heart disease. Doctors conduct newborn screening for CCHD by using pulse oximetry, which is a non-invasive test that determines how much oxygen is in the newborn's blood. So the Neonatal Behavioral Assessment Scale, or the Brazelton Scale, is also a test doctors use to test newborns and babies up to 2 months of age. The Brazelton Scale determines whether a baby has problems with the following things: interacting with the environment, so it checks their alertness, attention to sound and light and other factors, and their tendency to cuddle. Handling motor processes, it assesses their general activity level and reflex behaviors. Controlling his or her physical state, it looks at their self-quieting behaviors and levels of their excitement and irritability. And then responding to stress, it checks their startle reactions and their trembling. In the U.S., parents have a choice of whether they do or do not want their newborn baby boy to be circumcised. Circumcision is a surgical procedure that involves removing the skin from the end of the penis, which we call the foreskin. Parents choose circumcision primarily for religious or cultural and health reasons. The procedure is often performed 1 or 2 days after birth. Circumcision for religious reasons often occurs soon after discharge from the hospital. Circumcision carries benefits and risks, and parents may wish to seek advice from their doctor or a religious leader before making that decision. Okay, the well baby checkup. Before the newborn leaves the hospital, the pediatrician will ask parents to make an appointment for a well baby checkup within 3 to 5 days. A well baby checkup is a routine medical visit where the doctor examines a baby for signs of good health and proper growth. During this checkup, the nurse weighs the newborn and measures the length of their head and chest. The pediatrician reviews the family's health history, examines the newborn, answers parents' questions, and makes recommendations. Parents then schedule the next baby checkup. High-risk newborns are babies who are born premature, have a low birth weight, or have another high-risk condition like a congenital condition. In the U.S., about 12% of newborns are born premature every year, and 8% have low birth weights. Congenital conditions can affect the baby's heart, digestive tract, spine, or brain. High-risk newborns are admitted into a neonatal intensive care unit, or NICU, also called an intensive care nursery, where they receive immediate specialized round-the-clock care and treatment. NICUs are rated by level 1 to 4. Higher numbers are used for the treatment of high-risk newborns who are the smallest and most ill. The doctors and nurses who work in NICU have special training in neonatology. Neonatology is a branch of medicine concerned with the care, development, and diseases of newborns. More lives are saved in NICUs now than in the past, due in part to medical and technological advances. A change in policy, however, also contributes to more newborns surviving. Today, NICUs throughout the U.S. implement family-centered care policies, which encourages parental presence in the NICU, as well as parental involvement in the newborn's care and treatment. Parents are encouraged to visit the NICU to feed and touch and talk and sing to their newborns. Hospitals even employ surrogate non-family members in the NICU to hold and rock babies. Family-centered care policies promote a developmentally supportive environment, which provides newborns with the love, attention, and support they need for healthy growth and development. Okay? So how that works in the NICU is that each baby and family is assigned one medical team. Except for emergencies, medical and nursing care coincides with the baby's sleep and wake cycles. Parents are encouraged to participate in their baby's care by feeding, rocking, and doing skin-to-skin holding. The NICU is decorated and parents have their own space around their baby's NICU bed. And soft lighting and low noise levels provide a soothing environment for the baby. So after the last slide, what we just said, why do you think parental presence and involvement is critical to the development of newborns in the NICU? So why is it good when parents are around while their babies are in the intensive care unit? All right, so think about that. This is the end of Unit 6, Section 3. Thanks for listening, guys.